Hey, you guys, welcome back for our daily practice questions. It is day 249, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that y'all see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the things that I offer. But as always, I always like to direct you guys as well to my business profile where you can find my contact number, link to website, and testimonials from previous review students. Simply by going to Google and searching The Nursing Studio, it will take you right here to the business profile. All right, y'all. Question number one. A 49-year-old overweight male is newly diagnosed with type 2 diabetes. His A1C is 7.8%. He has no comorbidities. What is the best initial pharmacologic therapy? Is it A, metformin? Is it B, sulfonylurea? Is it C, insulin? Or is it D, a GLP-1 agonist? Take a moment and tell me what you got, y'all. All right, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the best initial pharmacologic therapy? So it's asking for treatment. And I always say when it's a treatment style question, you need to look and see if they provided you with a diagnosis. And they have. This patient has been diagnosed newly with type 2 diabetes and has an A1C of 7.8%. So how do we start? What is our first line therapy for a new type 2 diabetic? And the best answer is A, metformin. Question number two. A 12-year-old presents with itchy erythematous patches on the flexural surface of her elbows. The skin is lacinified. What is the first line treatment? Is it A, topical corticosteroids, B, oral corticosteroids, C, antifungal cream, or D, oral antibiotics? Take a moment and tell me what you got in the comments, y'all. All right, and stem of the question here states, what is the first line treatment? Again, when it's a treatment question, we look to see if they provided us with a diagnosis. And if they have not, you got to run it back a step further and look to see those assessment findings so you can determine what it is, right? So here, no diagnosis has been provided. So we're going to take a look at our assessment findings. We have a 12-year-old with itchy erythematous patches on the flexural surfaces of their elbows, and they're lacinified. Y'all, this is classic for eczema, aka atopic dermatitis. So the first line you want to go with here is a topical corticosteroid when we're talking first line treatment, right? So, just like we would do lifestyle modifications with anything else, if you're educating somebody on lifestyle modifications, then you're talking about your emollients and things of that nature. But when we're talking about first line treatments, as far as what we're prescribing, you want to go with your topical corticosteroids. All right, and lastly, question number three. A 66-year-old man presents with urinary hesitancy, weak stream, and nocturia. A digital rectal exam reveals an enlarged, smooth prostate. What is the best initial pharmacologic therapy? Is it A, finasteride, B, tamsulosin, C, Cipro, or D, testosterone supplementation? Take a moment and tell me what you got, y'all. All right, and stem of the question here, what is the best initial pharmacologic therapy? So again, it's a treatment question, so we need to look and see if a diagnosis has been provided, and it has not in the scenario, so then we need to run it back and look at these assessment findings. We have a 66-year-old man who comes in with urinary hesitancy, weak stream, and nocturia. The DRE reveals an enlarged smooth prostate. When we say enlarged smooth prostate, I want you to think BPH, right? So then ask yourself, what is the first line therapy for BPH? And your best answer is B, tamsulosin. All right, you guys. Also, quick tips on prostate. I get a lot of questions with some of my one-on-one review students about prostate, and I like to kind of like key in on these areas so that y'all, when you see certain terms, it puts you in the mind of certain things. So, for example, like I said, if we're saying like an enlarged smooth prostate, think BPH, right? If they say boggy prostate, I want you to think prostatitis, like think big, boggy, inflamed, right? A normal prostate is supposed to be hard, like the tip of your nose. And then if they say a prostate wants to put you in the mind of prostate cancer. Especially if they associate it like with things saying like the PSA is elevated and things like that. Also, if they mention prostate nodules, so firm, they talk about an elevated PSA, they talk about prostate nodules. They're trying to give you key identifiers for prostate cancer. Again, normal prostate is going to be hard, like the tip of the nose. So if they mention that tip of the nose scenario, they're trying to tell you it's normal. Enlarged prostate, smooth, we're thinking potentially BPH, boggy, prostatitis. All right, that's my rundown to kind of give you those key identifiers when they're talking prostate and how to think about it. Okay. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I offer, feel free to reach out to the Nurses Studio. You know, you can give us a call, shoot us a text message, shoot us an email. And as I mentioned before, my website is linked in the description, and everything that I offer is also linked in the bio of this channel. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.